So one pushback I've heard on that is, well, if I send in my full fee and the patient sees it on the EOB, it's going to turn them into more of a PPO patient because they're going to see how expensive it is to come to me versus if it was PPO. And, the conversation I have with them, and let me know if you have a different one too, because this can help everyone. What I usually say to them is if you're not comfortable with the high fee, if you perceive it as to be a too high of a fee, that's a separate conversation. You need to really take a look at like what your cost of goods is, what your overhead is. Are you billing just because you hear the guy down the street is billing this? If you're not comfortable with your full fees, that's a different conversation than will the patient be scared of it,
Sure.
So that's kind of my saying to them. Do you have people saying, oh, it's just easier to do low fees on the EOB? What do you hear?
The conversation that I have is I think your UCR should be listed everywhere. It should be when you're treatment planning, you should be informing the patient of the usual and customary rates, because you always say this is the cost if you had no insurance, no dental coverage whatsoever. This is the cash fee. Well, your great insurance also reduces it to this and they pay in towards it. So for me, it's easy for the patient. I feel like it's easier for the patient to understand, like I do have good insurance coverage and I do, some of those things. So that's the reason why I like to see UCR everywhere. Like this is my actual cost. This is the discount you get by coming to a contractor provider. And this is what your plan pays into it also too. But
and you also have secondary insurance. You've got two different fee schedules that you got to deal with. So which one are you going to be putting on the claim form? Like, why have that discussion? Just put the full fee on the claim form. Wait for everything to come back in and take care of it. So one thing that I've been hearing, I'm trying to kind of track this down and see about it. We talked a little bit about it in the pregame. Just want to kind of make it a consumer awareness point, I guess, for our listeners. There's a thing going around where you would collect the coinsurance amount of the full UCR. No, say you're a Delta provider, you're not collecting a coinsurance based on the Delta fees. You're collecting it based on your full fees. So you're going to get paid by the patient more than they should have. So you're actually collecting more. And then the follow-up thought on that is then you use that amount to get more work done because, now they have a credit, right? But you and I have spent a lot of time looking at contracts. I'm going to go double check it, but I have a funny feeling that most of the contracts say you have an obligation to collect what the patient's coinsurance is and not more. Do you feel like you've seen that before in a contract?
I don't have to double check the contracts. I know it's in almost every dental plan. I've seen many contracts and it's absolutely written in there that you can't collect anything more than what the patient's calculated copayment is for those. So And why have all of that? Like, what an AR nightmare, right? Why have all those credits sitting on your account? And if you're looking at selling your practice also too, they're looking at those credits negatively. They're not looking at them as a positive. So there's a lot of reasons for not holding on to those credits.
Well, and if you have consumer complaints too, like what if you're violating, I don't know what California says, but every state has unclaimed funds law where if you're holding on to a patient's credit for longer, you have to actually pay the state. The state has to hold on to it. Would you like to hear more? Follow the link for the full episode.